to you, Masimba.
Thank you very much. I've tried to answer or some of the questions from the feedback program or evaluation list that I've been given here. So I've attempted to answer each and every question, and I'll actually like giving some bullets on all the answers from each and specific question. But before I go into my presentation, I also wish to thank CILIP, HLG, ILIG, and FI for affording me this opportunity to attend the CILIP HLG Conference. We also go through professional development programs where I visited a lot of health sciences libraries in London, Birmingham, Glasgow, and Edinburgh. And I thank them for giving me this opportunity to get the international perspectives of health librarianship in the UK. On my presentation, I'll attempt to give my personal objectives which I had before coming into attending this professional visit program, and also give the highlights of the program, key benefits of the program, the HLG conference which I also attended, the learning outcomes from the visit, suggestions for improvement of the program, and activities already taken forward. That is basically items that I've realized that they are actually implementable or they can be replicated in our own setup in Zimbabwe and in Southern Africa as well as in Africa. Then also areas where perhaps we think we can actually have follow-ups on this professional visit that I've gone through for the past 2 weeks. In terms of personal objectives for the visit, I think, well, basically my personal objectives for this visit were simply to understand and learn the best and current practices in supporting health, in supporting and sustaining evidence-based healthcare delivery, information skills training, open access advocacy, outreach activities and programs, then health libraries consortium. And the other key objectives as well was to meet and interact with the health librarians and benefit from interactions as well as cross-pollination of ideas and experiences. These were basically what I had in mind before coming in for this 2-week project and program. And essentially I was also like kind of looking forward to benefiting and fulfilling all these objectives during my visit here. So from there now, I'll take you perhaps through the specifics now. In terms of the highlights of the program, the major one was the CILIP HLG conference, where I was privileged to give a presentation there, and it also gave me the opportunity to get to know the global perspectives of health sciences librarianship, as well as interacting with fellow librarians and publishers. It also gave me the opportunity to meet with clinical librarians involved in EBM training, information skills training, as well as understanding the general administration and management of health sciences libraries in the UK. Then I was also privileged to go enjoy tours and visits to beautiful scenery in the UK, Scotland, and Birmingham. I think you also see a lot of gallery from taken through during this visit and tours. Well, that's a screenshot of my presentation. I think someone just took me this picture during my presentation at the HLG conference in Glasgow. And well, I cannot judge my presentation, but it could be for the people who attended really to judge it. But from my own perspective, well, I basically think that the presentation was well received. People really appreciated it, and even from a personal perspective as well, it also gave me the opportunity to present at a bigger platform, at an international platform as well, which also perhaps has a very strong impact on my personal development in terms of how to present as well as how to manage some such kind of things at international levels. Then this is also a screenshot of one of the tours that I had. I suppose this should have been the British Museum again, which is also one of the highlights for my visit. Then the key benefits from this program, One of the key aspects which actually came out is the international perspective or international exposure. Ideally, I am of the view that we are living in a global world where everything has been shrinked to say anything that happens in any part of the world, be it good or bad, has got a bearing on whatever we seek to achieve as at a global level. So this international perspective also gave me a in-depth understanding of health sciences librarianships in the UK, and also trying to gauge it and benchmark what we are doing at the University of Zimbabwe in Africa and in Zimbabwe to be specific, based on the standards that are prevailing currently in the UK. It also gave me the opportunity of exchange of notes on the latest and best practices. I was exposed to the best practices. I also had the opportunity to go through and actually benefit from real success stories that have been done in several NHS libraries as well as academic libraries in the UK. And actually at the end of the day, it gave me an indication of what is the latest things and the best practice in health sciences librarianship. Then it also gave me the opportunity for networking, partnerships and collaboration. I think out of all this TWIC program, I've managed to get so much contacts, so much networks, say that given that maybe I encounter any challenges or I need maybe any assistance, it's much easier for me to connect with colleagues who are also in practice and in any way better our work in Zimbabwe. Then it also gave me this idea of strategic perspectives of health librarianship. By this I'm simply saying, well, I believe our profession is there for the next 15, 20, 30, if not for the century to come. So from this juncture or at this present moment in time, one has to kind of look at the next 5 years, the next 10 years or the next 15 years to say, what is it that we should do right now that can actually enable us to exist and also to remain as key components in healthcare delivery, medical education, teaching and research at a global level. So this opportunity also gave me that perspective to look ahead to say, what is it that we need to do currently so that we still remain relevant in the coming years. Then on the HLG conference feedback, it is my view that this was an excellent platform which allowed for an introspection of the status of the health libraries through innovation, initiation and continuous improvement of services, which was highlighted by the presentations, the posters, the testimonies by colleagues and people who attended this conference as well. It also gave that opportunity for sharing of best practices and success stories from a lot of other presenters as well as individuals who were also sharing with colleagues on how they are doing it and the challenges that they've been facing and perhaps the breakthroughs in whatever they've been doing. It also gave the opportunity for networking and collaborations among health librarians as well as publishers. I think I also got the opportunity to network with a lot of publishers who were also part of the conference proceedings. And overall, this was well organized in terms of the venue, the conference facilities, as well as the presentations, which were well polished, and they were in mostly covering the broad aspects of the health sciences librarianship. And in any way, everyone found something really relevant out of this HLG conference. However, I'm also of the view that besides all this, to a large extent, this was a very successful conference. But however, I'm of the view that it provided limited time to digest and deliberate on presentation, and also perhaps also giving the people to maybe come up with suggestions, with ways forward, and I would perhaps think that maybe a plenary session and a final plenary session that would seek to wrap up everything, deliberate on challenges as well as coming up with a resolution to say what is it that we will seek to achieve during these 2 years or before the next biannual conference, and maybe just get a feedback from participants to say what is it that we should do as CILIP HLG. That was my own opinion, to say maybe that would be an area which maybe people can really think about it and scrutinize, as well as maybe see whether that can be something really well. Then, well, after the conference, we had a dinner dance, and we were privileged to be hosted by, was it the council, Glasgow Council, and we were also involved in a lot of dancing. We had a magician, we had this other guy, the comedian as well. And this one just picture, someone actually picked it from, actually took me this picture. Then later on when I was visiting them in Glasgow, then he said, no, I have your picture when you were dancing during the Glasgow dinner. And it's another one as well. Then in terms of learning outcomes from the visit, basically here I'm looking at tangible, implementable, or replicatable aspects that I realized from all this visit, the conference, as well as the trip. One of those key aspects is a repository of in-country evidence-based resources. And one perfect example of that was like the NHS evidence. The challenge that we face in Zimbabwe and most African countries is a lack of a platform or one-stop kind of gateway to providing access to evidence information. And I got this idea of NHS evidence based on the resources that I was shown during my visit. And I believe that is one of those areas which I think it can be a very good starting point in terms of providing access to evidence-based information in Zimbabwe and in Africa. And as well, it will also be important from the perspective that most of the literature that we get, be they evidence-based or even articles or something of that nature, it's actually easier for us to get access to foreign publications, the Elsevier, the France and Taylor, the Sage, and many others. But this platform for locally produced evidence information, currently it doesn't exist. So it could be one of those areas which I think could be a fruitful area to actually work on. Then clinical librarianship. No, basically this is a new, let's say, branch of health sciences librarianship which is coming on. And I was also exposed to clinical librarianship when I had some visits in Glasgow, and it actually was pointed out that there is also a need for a health science librarian to be involved in ward rounds with clinicians, so that we can also be able to provide access to the evidence-based information that they want, or during like a clinical question time where they look at clinical questions, then they also need access to the evidence to substantiate their practice. So it's one area that we are also looking forward to working on. Then strengthening of trainings. Basically, some of the trainings that are being done here, like the information skills, the evidence-based literature searching, we are almost doing them as well. But out of all this visit, I realized that maybe we need to maybe benchmark our trainings to a higher grade or to a higher standard, like what some of my colleagues are doing here, and also extend it to trainings like critical appraisal, whereby maybe one is to look into looking at how research was done, whether it was systematically done, and so many other things as well. So it's one area as well which I think we can be able to really take on board. Then stronger and visible consortium. This is mainly based on country chapters of health sciences librarians and health librarians in the country. And one perfect example was the one about SHINE. I think it's the Scotland health whatever network of medical librarians. I think it's one very good example that I saw of a visible, a proactive and country chapter or consortium that does a lot in terms of capacity building amongst themselves, sharing resources, sharing experience, and many other things. So basically it's one area which I also realized that there's also need for us in Zimbabwe to perhaps replicate and also tap a lot of experiences from the SHINE experience. Then advocacy for stronger regional and international partnerships is also one of those things which I also realized from all this visit. There's also need for collaboration and stronger partnerships with the Network of African Medical Librarians, ILIG, ITOCA, which is also a regional organization involved in capacity building and training of health science librarians and researchers in Africa, CILIP, HLG, partnerships in health information, as well as ILIG. Broadly, I think there is need for all these associations, consortiums, and organizations to kind of find each other and perhaps work towards achieving a unified goal. Because in most cases, I believe that whatever these individual networks or associations are doing, they've got some areas where we kind of interact, or where we find a common ground per se. So the best thing is now to say, where do we fit in, where do we find common ground, and maybe work towards achieving one common aim. Then in terms of our service, also marketing, advocacy, and promotion of library research and product is also one other element which I also learned quite a lot during my visit. You know, the use of Web.2 and Library.2 technologies in terms of reaching out to healthcare professionals, academic staff, medical doctors, and so forth, using those tools to reach out in terms of selective dissemination of information and very specific resources that takes care of their needs. Then the other one was also on publishing. It is also my considered view that from all the interactions that I had with all my colleagues here during the conference and even during my visit, perhaps there's little much on publications, be they reports, be they articles, or even newsletters on the status of health science libraries in Zimbabwe or even in Africa. And to my own view as well, this bursary that I have received is basically a seed that is perhaps trying to maybe better my personal and professional development, as well as extend to the people of Zimbabwe and Africa. And in any event, there's not going to be any second bursary that is going to come to me, to be realistic. So I would think that one of the contributions which can actually bring positive results to even all this professional visit and the investment that has been put in my trip and all the trips that I've done is also publishing. To say at some given time, we say that guy or the person that we exposed to what is happening in Zimbabwe, in the UK, has managed to publish, and this is what is happening in Zimbabwe as far as the health sciences librarianship is concerned. So I strongly believe that one of the learning outcomes that I got from this trip visit is to communicate through publications and any other form of communication which is kind of scholarly. Then in terms of suggestions for improvement of the program, I think generally the program had extensive consultations, and to a very large extent it was appropriate and relevant to my needs and my expectations as well, based on the initial objectives that I highlighted on. I think I had very good exposure as far as open access is concerned. I had visit Welcome Trust, where I had that benefit to network with those people who are involved in a lot of open access advocacy, information skills. I actually been attended one of the trainings as well, information skills, evidence-based healthcare delivery. I was also exposed to all these things as well. And overall, my joy is to say my program, as well as how everything went on, it was not cast in stone. It was very flexible to me, and I really found it to be very, very useful to what I really expected. However, one of the areas which I kind of pointed out, which might maybe need a bit of a relook, is in some cases I would get maybe a duplicate of experiences, especially through the NHS library system. In some cases, what you would have seen in one institution could be more or less the same thing that you are going to be taught in another setup, except perhaps a change of accent. You say that Scottish and that one is another one. But overall, the program was very good to me. I find it to be very relevant and really meeting my expectations and my needs. I think everyone who was involved in coming up with this program, and it's been very beneficial to my personal and professional development. Then activities already taken forward. Basically, I suppose this is on as well on the tangible aspects that I think can be replicated in Zimbabwe, or where we can learn or even better our service, both in Zimbabwe and even in Africa. And I think the aspects or the points that I mentioned in slides 8 and 9 basically could be the ones that can actually come in there as the tangible aspects that I'm going to work on in terms of replicating them in Zimbabwe and in Africa. Then follow-up items. Well, basically, I suppose these are the things that we can negotiate to see the feasibility of further exchange of programs, to see that what next is it that we should seek to achieve after all this training and this exposure. And one of those is basically exchange as well, in terms of it might not be necessarily people coming from this end to that end, but even electronic means as well. It's also a very brilliant way of exchanging experiences and programs and what people are doing in this other part of the world. Then strengthening of Zimbabwe country chapters through the Zimbabwe chapters, that is perhaps the Health Libraries Consortium. I think it's also one area where, in my view, it could also be interesting to maybe also feedback on our progress, on our efforts, on any tangible or visible programs that were involved in Zimbabwe as a way of strengthening healthcare delivery in Zimbabwe, medical education, teaching, research, and all other things involved. Then outreach and capacity building programs, fortunately we have got ITOCA, which is also in Southern Africa. I think this is one of the areas again where we can actually have follow-up to say how best can ITOCA also feed into strengthening of these country chapters, training people, capacity building, collaboration, and many other things as well. Then the other one, I'm of the view that perhaps this visit can also present me with the opportunity of playing an ambassadorial role in Zimbabwe and Africa, as far as linking with the CILIP, HLG, FI, and ILIG. I know perhaps there have been other efforts that have been done through Network of African Medical Librarians as well as AHILA, and perhaps there are other projects which are already underway. But I think for us as well, it will also be an opportunity for me to come on board and even provide any form of assistance or even knowledge or experiences which can be possible at any given time. Then collaborations with Network of African Medical Librarians, AHILA, and any other African-based or international association. That would also be another area for follow-ups as well. Basically, I think that was a brief of my feedback on the 2 week visit that I had. I thank you.
Thank you very much.